as I mentioned, over 150 plus providers. Every single provider is leaking significant amounts of money. So the first thing is do the analysis on your houses. For each of your houses, look at the participants' funding, look at the roster cost for that house. Is it aligning to the funding? And then on the claiming, is that aligning to the roster?
So they are receiving all of this funding from SIL participants. They're putting support workers in there, and then they're not aligning the amount of money being received with the amount of money they're spending, and they're not adjusting when things change.
Completely right. So it really comes down to that fundamental alignment between the funding, the rostering, and the claiming. And then the other part that you mentioned, which is essential to all this, is the ongoing maintenance.
So what steps can providers take to address some of these issues?
So I think the very first step every provider should take is...
Every SIL provider knows the challenges: compliance, rosters, claims. But what if you could work smarter, grow faster, and make a bigger impact? Welcome to SILosophy, where we have real conversations about what it takes to succeed in supported independent living. This podcast is powered by Taniagomez Consulting and Resolv. Let's get into it.
So welcome to SILosophy. Today I'm joined by the wonderful Josh Pix from Resolv. Welcome.
Thank you for having me.
And thank you for being the sponsor of this podcast. It's awesome to have you on here.
Yes, I mean, what we're really about is trying to educate providers as much as we can about what can be done to improve SIL. And these podcasts are a great opportunity for providers of all sizes to come in and understand more about the industry, bit of a chance to collaborate and gather information and share that across all parties.
Yeah, it's amazing. It's been amazing to work with you on this project. For those listeners who haven't heard of you or Resolv before, can you give us a little bit of a insight into what you do and who you are?
Yep. A lot of people are confused if they look at our website or try to understand exactly what we do. So it's probably best to start with who we are. So we started Resolv about 18 months ago. Rick and myself, we'd previously worked for a disability software provider. So we've been in the space for around about 7-8 years now. During that experience, we saw the struggles SIL providers were having, particularly SIL providers, and joined forces with Adam, our third founder. Adam actually started his career as a support worker in SIL houses about 8-10 years ago. So when we talk about SIL, it's very much a lived experience for us, and it's one of the reasons why we've got a lot of passion for the industry. When we're actually starting Resolv, Adam actually went back and worked in SIL houses again as a support worker. So 15-18 months ago. And so what we really saw was that no one was helping SIL providers. They were doing amazing work. And a big issue within the SIL space is profitability. And what providers aren't aware of is how much money is being lost through rostering and claiming. So what Resolv does is we form long-term relationships with providers and work with them to get their rostering and claiming right. And as a result of that, are able to identify hundreds of thousands, if not millions in some cases, of millions of dollars that we can put back into the providers, which translates into better outcomes for participants, because that's what we're about, is really enabling providers to do what they do best.
Amazing. I think we're very aligned on that. We just come from two different angles of the same coin. One thing that, in our conversations and in working together that I've heard you talk a lot about is that SIL is broken. Can you explain what exactly you mean by that?
Yes. I know sometimes I get criticized about being a little bit pessimistic about the SIL industry, but based on the exposure that we have to providers, hearing their stories, seeing what's happening, you can only reach one conclusion: that the SIL model is completely broken. And there's really two key aspects to that. The first is the complexity of getting rostering and claiming right. So the core function of creating a roster for the house and claiming for the support being delivered is extremely, extremely complicated. And if you look at all the changes coming into the space, it all trends towards more complexity. You never hear anything coming out that's making life easier. We're still stuck with the rock tool. which has been around pretty much since the inception of the NDIS. So you have this very complicated beast of rostering and claiming, coupled with chronic underfunding. And I'm not talking about the participant's plan size. I mean, that's almost a given in this space. But the actual business model of SIL is chronically underfunded. And as a result, you have staff doing the job of 2 or 3 people. So you've got a operating model that's extremely complicated with no funding to support it, which then results in providers not being able to get the core function of rostering and claiming correct. And as a result, they're losing very significant amounts of money just on the core function of creating a roster and claiming.
Yeah. I've heard you talk a lot about SIL providers losing money. And obviously, it's in all of the data and the reports we look at is that SIL providers are losing money. Do you know how much, or like how do we quantify what the losses are?
Yeah, sure. So talking about just about rostering and claiming, because there's a whole range of areas where I think providers can make improvements on profitability, but the most significant is just on the base functions of rostering and claiming. And we've analyzed well over 150 plus providers now, and we've identified at least $25,000 per participant per year on average providers are losing purely through not getting rostering and claiming right. And I don't want people to overcomplicate this in terms of this isn't about overtime. This isn't about it's no more simple than just the roster for the house and claiming for the support that you're delivering. That the breakdown of that process is costing providers $25,000 per participant per year.
So explain that to me. How can it be costing them that much?
Yep. So it really comes down to the 2 key areas of rostering and claiming. So on the rostering side, where we're seeing significant parts of that loss is around unintentional overservicing. So it's almost a given. Every provider for some participants will need to overservice, but there's a lot of cases where they're providing more support than they probably intend to. And there's a whole lot of reasons for this. Like a classic example is for a particular care reason, some additional shifts may be added. That care situation may resolve itself, but that shift still maintains on the roster. And so then before you know it, you're providing $2,000 or $3,000 a week of more support than you intended to. Another major area on the rostering side is lack of a clear understanding between both the SIL and the CP, the community participation aspect of the funding. So they're not really clear what are SIL shifts and what are CP shifts, and as a result, that leads to significant amounts of unintentional overservicing.
So when we talk about losing money on a participant, what does that mean? Can we break down the costs?
Yeah, sure. So that's really where that $25,000 per participant per year cost comes from. Because like in a house, to make it as simple as possible, a house may have $10,000 of funding across the participants that are in that house, but they may be providing $13,000 worth of support, but then only claiming $8,000. And it's those numbers that very quickly add up. Like we're talking about 24/7 support. The weekly support for a house is not a small number, and just getting that wrong slightly is adding to a $1,000 or $2,000 amount across 50 weeks. It climbs up there really, really quickly just for single houses. Like we've seen individual houses with only 3 participants costing those businesses over $250,000 alone at the extreme cases.
Right. So they are receiving all of this funding from SIL participants. They're putting support workers in there, and then they're not aligning the amount of money being received with the amount of money they're spending, and they're not adjusting when things change.
Completely right. So it really comes down to that fundamental alignment between the funding, the rostering, and the claiming. And then the other part that you mentioned, which is essential to all this, is the ongoing maintenance. Because the one thing everyone understands in SIL is that everything changes all the time. So just when you've created a roster that is correct for that house, you've got the claiming aligned, well then participants' funding changes. A new participant comes in, a participant exits. There may be sudden hospitalization or incarceration for a period of time. And then the roster and claiming also needs to occur again. So it's not just getting it right, but then it's the ongoing maintenance, not to mention change of circumstances, etc.
So, what steps can providers take to address some of these issues?
So I think the very first step every provider should take is to, as best they can, understand, are they suffering from these potential losses, and where are they coming from? Because after reviewing, as I mentioned, over 150 plus providers, every single provider is leaking significant amounts of money that they deserve. So we're not talking about, this is all about claiming for the support that's being delivered. So the first thing is do the analysis on your houses. For each of your houses, look at the participants' funding, look at the roster cost for that house. Is it aligning to the funding? And then on the claiming, is that aligning to the roster? Because that's another big contributor to this $25,000 per participant number. On the claiming side, it's the main cause is just not aligning the claiming amount with the roster. But there's a whole range of issues that you can get to on the claiming side. Is when payments are rejected, what is your process to make sure that you're following up on those rejections? So we had a provider recently, we just did a 3-month analysis on their rejections, and we were able to identify $300,000 that could be claimed. The rejection was purely just an administrative issue.
Right.
So it's just about keeping on top of those things. The other issue we find on the claiming side is even when the funding for the house is correct, the funding for the individual participants may not be correct. So you may be overclaiming for one participant and underclaiming for another. And then likewise, understanding the funding sources, making sure that you are claiming the SIL for the SIL support that you're delivering, and community participation likewise for that. So the number one thing every provider should be doing is first identifying how much of an issue do I have, and then having a look at investigating the specific problem areas that they identify.
Wow, that's really, really interesting to think about it as almost just in that example, it's a process issue. It's a process issue that it's just leakage, leakage out of the bucket.
Correct. It really comes down to, so another major factor is a breakdown in communications between the client services team and the finance team. These are two parts of organizations that have different priorities. At a holistic level, everyone's, regardless of their role in these organizations, is trying to ensure the best outcomes for the participant. But the lens that client services does that versus the lens that the finance team does that is very different. And it's there's just always clear breakdowns in terms of when more support is being provided, is the finance team being notified of that? Because as the roster changes, claims must also change.
Yeah, right. When you're talking to providers for the first time, what's your number one tip for them to establish if this is an issue for them?
Sure. So one of the big issues here is, where can I even get the information? So I say, what's the first thing you should do is you should look at your funding, rostering, and claiming. But a lot of providers don't even have easy access to that information. So one of the first things that we do with providers is something that we do completely free of charge, because it's very important to us. As I said, SIL is very important to our organization, and we spend a lot of time giving advice and guidance to providers to help move them towards better outcomes. And one of the ways we do that is a health check, where the first thing we do is we get a NDA signed to make sure the participant's privacy is protected. But then we work with them on gathering that funding, rostering, and claiming information in order to do the analysis to identify exactly how big the problem is within that organization. So once we've worked with them to gather that data, within 24 to 48 hours, we're able to put a pretty accurate number to the size of the issues within that organization, and then we're able to give guidance around how can potentially address that. So that's one thing we very much encourage every provider. If they're listening to this, every provider, if you talk to them about their rostering and claiming, and how is it going, the feedback's always, it's definitely an area of it's definitely an area of concern within that organization. But the nature of SIL is that there's always more fires to put out, and it's not something that they turn their mind to. And so we strongly encourage all SIL providers to reach out to us. Again, it's completely free of charge, and we'll go through and do the analysis for them so they can work out how big of an issue it is, and then give them some guidance on what the solution pathway for that problem may be.
Yeah, amazing. And if people wanted to take you up on that offer, how can they reach out?
Yeah, sure. By all means, the website is the easiest way to get in touch with us, but we're very easy to track down. Reach out to us on LinkedIn. We'll make my email available as well. One of the hardest things is really encouraging providers to have the conversation. Every time I do a webinar or something like this, or meet providers, I'm always encouraging, take advantage of us, have a conversation. Like, we're in this space to help you. We're in this space to give you as much guidance and advice as we can, and there's not a price attached to that. So yeah, by all means, reach out to us via our website, LinkedIn, wherever you can find us. Please, the most important thing is we're easy to find, but just make the jump, have the conversation, because we'll be there to help. And then as a result of what we can do, we're able to put a lot of money back into these providers. In 2024 alone, we've pushed over $5 million back into providers, which then translates into it's allowed providers to fix maintenance issues within their houses, improve training for their staff, additional transport for the organization. All of this translates to better outcomes for participants, which is what we're trying to drive in this space. Because everywhere you go, the consistent message is there's not many positive messages in the SIL space. Everything is trending towards one direction, and so we're hoping to be a force against that, to actually give providers a bit more positivity in this space.
Wonderful. So today we talked about the system around SIL funding. We've talked about what those losses look like, what the sources of those losses are, how to address some of these rostering issues and claiming issues. Is there anything else you think that somebody needs to know when looking at their rostering and claiming?
The number one thing to know is that, without a doubt, this $25,000 per participant per year number is not other providers. It is you. So if you're listening to this, you're providing SIL support, there is absolutely no question in my mind that there is significant amounts of money within your organization that's being lost to these issues. I think we hear these stories, we think it applies to other people, but like I said, we've been doing this for quite some time now, and without a doubt, every single SIL provider has hundreds of thousands of dollars within their organization waiting to be unlocked and put to much better uses.
Great. That was great. Thank you so much for joining me today.
Too easy. Thank you very much, Tania.
That's a wrap on this episode of SILosophy. If this resonated with you, take a second to subscribe and share it with someone in the SIL space who really needs to hear this. Don't forget to connect with Taniagomez Consulting on LinkedIn, Instagram, and Facebook for more resources, conversations, and support to help you grow your impact. Thanks for listening. Until next time, keep making a difference.